perhaps, but just want to reiterate again our deep concern over the issues that are taking place in a number of Indigenous communities, and of course most recently in Attawapiskat. And Minister Bennett and I, as you know, are working on an emergency response to address the immediate needs in this community. We've been in touch with National Chief Bellegarde, the local Chief Shishit, as well as other Indigenous leaders in the community, and made sure that the mental health resources are in place immediately. And I will be working with my colleague Minister Bennett to respond to the longer term needs in the community to prevent these kinds of crises from happening in the first place.
Yes, I too spoke with Chief Shishit as well as the Grand Chief Alvin Fiddler. I think that they want the immediate mental health supports, but they also know that this is a long-term tragedy that is been ongoing, and I was very pleased also to speak to Charlie Angus just now before question period in terms of how we have to build these communities back and give the children hope, and that is the kinds of investments in education and housing but the language and culture piece is, I think, what a lot of people feel. These investments to secure personal cultural identity is how these kids feel proud of themselves and where they're going, and that's been something that's been so important and so lacking in some of the schools across the country. So we will continue to work with the Chief and the Grand Chief and the National Chief, but and on a separate other tragic issue, I will be going to Pakanjikum on Friday to deal with the huge problems that came from that fire and those deaths.
But what about
Of course, Pakanjikum, also a First Nations community in Ontario that has a chronic problem of suicide. David Zimmer is Ontario's Minister of Aboriginal Affairs and joins me now from the provincial legislature in Toronto at Queen's Park. So, Minister, the emergency medical assistance team that the province is deploying, I understand, has now arrived at Attawapiskat. What will they be doing when they hit the ground?
Yes, the Ontario Medical Emergency Team arrived at about 2 o'clock this afternoon, I'm told by the Ministry of Health officials. It's a crisis intervention team, healthcare workers, mental health care workers, and social workers. They are going to do an immediate assessment of the situation. This situation became a matter of public record over the weekend, the multiple attempts at suicide. So they want to get a grip on what exactly the situation is as we speak. Along with the provincial emergency task force that's moved in is the Muskoka Tribal Council, which is the tribal council that takes in the James Bay coast area, including Attawapiskat. They also have sent in an emergency health response team, and I understand the federal government has sent in a team yesterday of 2 people. So the other thing that's happened today, there are conversations between the parties, the federal government, the chiefs, the grand chiefs, the province of Ontario, and we're trying to coordinate our efforts to deal with this emergency crisis. The larger piece then is what are we going to do in the longer term to prevent these tragedies from happening.
You're quite right when you said a moment ago that it's become part of the public record now that there were these roughly a dozen attempts made over the weekend, but in fact there have been about 100 attempts going back to September. Why is the team just going up now when clearly there's been a crisis in place there for some time?
We've been aware of the situation, and these suicides and attempted suicides have been occurring over the last couple of years. We have, from time to time, sent in response teams to deal with it, and they've been dealing with it sort of on an individual or smaller scale. But these events over the weekend are of such a horrific scale that it's really triggered this coordinated emergency response to get to the bottom of it and to stop it in the short term. And then there will be ongoing conversations and strategies about how to deal with this on a long-term basis, because we've got to tackle the root causes. It's not just enough to deal with the situation that occurred this weekend, but what do we do so it doesn't happen over the next years?
So let's begin with the near term. And what are the concrete things that the team is doing? Because I can't even imagine what it is you face when you arrive and you find, first of all, that this has taken place, that it's chronic, that the range and age of the people who are attempting to take their own lives goes from, mid-teens or young teens to someone who's in their 70s. What is the actual concrete task of this team?
The concrete task of the team is they are experts in, among other issues, mental health and dealing with social crises. So the experts are going to assess the situation, what they think can be done both short term and in the longer term. There are then ongoing conversations that will be occurring today and tomorrow, at which we will receive the advice of these expert mental health workers and social workers. I should say that from Ontario, Minister Hoskins, the Minister of Health, and Minister McCharles, the Minister of Children and Youth Services, are going up to Attawapiskat the middle of this week, I believe on Wednesday. So that will have given the expert response team a couple of days to come up with some immediate strategies and immediate assessment of the situation, report to those two ministers. Then they will coordinate with the Ministry of Aboriginal Affairs here in Toronto, and we'll coordinate with the federal government and tackle this both in the short term and then, as I say, sort out a long-term strategy to try and stop these tragedies from occurring.
I mean, that really is the uncomfortable truth of this, is that it's really news to no one that these problems exist in these communities. You talk about the long term. I mean, what is it that the government is going to do tomorrow that it didn't do yesterday?
Well, on a longer term basis, we've got to work out a strategy to provide hope and a positive environment for these young people and indeed some of the older people, older community members who've attempted the suicide. They are dealing with problems of social isolation, unemployment, lack of opportunity, insufficient school system. The school system, for instance, the high school students, typically the schools go to about grade 8 or grade 9. Then there are people, if they want to go to high school, come south, and by south I mean that Thunder Bay, Sudbury, Timmins, and so on. In the past, the former federal government did not have the same degree of heightened interest that the new government under Justin Trudeau has. So we are very hopeful that with the new federal partner, working with the provinces and working with the First Nations in Ontario and indeed across the country, that this new relationship can tackle these issues in a more meaningful and hopeful way.
They certainly are serious. Thank you for your thoughts on this.
Thank you very much.
David Zimmer is the Aboriginal Affairs Minister for the province of Ontario. He joined us from Queen's Park.